pain sure can be miserable.
I cried, and I said, I can't take this anymore. I can't go on like this. I have to do something.
Nothing would take the pain away.
My daughter was 4 years old, and so one of the things that really killed me is not to have the ability to pick her up and hug her and squeeze her all the time.
But I was at the point where I just didn't feel that I had a future with pain like that.
They sound pretty desperate, but that's how it gets, all because of an age-old problem that's been nagging people for years. And what's worse is trying to pinpoint exactly where it hurts when it seems to hurt all over.
I felt like a sponge. You know how you take a sponge and you just wring it dry to get all the water? I felt like a twisting type of a sensation, followed by a lot of burning.
The pain was just terrific, and it was in my back and all down the right side of my hip and my leg, clear to my ankle.
According to statistics, back pain strikes 8 out of 10 people at some time in their life. But what the numbers don't show are how others are affected by the pain.
He was grumpy. He was irritable, and he had basically no patience at all.
So we really kind of kept him away from customers as much as we could because of his condition.
Everybody just avoided him because he just was so miserable, and it just was making everybody else miserable.
I could see that my relationship with people around me was deteriorating, my customers. I was short with a lot of my customers when I shouldn't have been, and with my family.
Today we've come to the Cleveland Clinic to find relief for these back pain sufferers, get them back on track to enjoy life and the people around them. Hi, I'm Edward Asner, and I'm here at the Cleveland Clinic talking about back pain. Even though the spine is one of the most vulnerable structures in the body, we just expect it, well, actually demand it, to take the bumps and grinds and loads and lifts that we put upon it every day. And I'm not talking about daredevils and thrill seekers, just ordinary people doing ordinary things. Take Joe Babica, a young painting contractor. He was doing something that he'd done hundreds of times, just business as usual, and then it happened.
I was placing some samples into the back of my truck, and I had stepped into the back of the van in a bent-over position carrying some weight. And I felt a pulling in my leg. I thought I pulled a muscle. And as time progressed, it got worse, and the doctors tested some sensation in my leg. And at that point in time, we noticed that it was numb going down the back of my leg and down by my foot, and they told me that it was much worse than a pulled muscle.
For professional nurse Anna Maria Cora, pain struck while lending a hand to an elderly patient who was falling into danger.
So what I did was reach over, I pulled him up, turned him and placed him in his wheelchair. And subsequently, I tore muscles and bruised muscles in my back. A few hours later, I had this hurting, burning sensation, and it was a downhill story from there.
And downhill was exactly how it went for Jan Zidek, an executive secretary and active mom. Jan enjoyed skiing, hiking, and spending time with her family until one day when she took a ride that was far from amusing.
I didn't feel anything until I went to get off of the roller coaster and started to walk, and I did well to put one foot in front of the other.
When she got off the roller coaster, she just could hardly walk to come off the ramp of the roller coaster, and she said she jarred, something jarred.
And then from there on, it just continuously got worse. I came home and had an MRI taken, and the MRI at that point, they read it said it was a bulge disc.
Chronic back pain is seldom related to any specific injury. For some, the spine just wears out, as it did for kidney dialysis patient Bill Kezor, a former law enforcement officer and current charter boat captain. The presence of back pain not only complicated Bill's fishing season, but his entire life.
I got a severe muscle spasm on the right side of my body, and I felt something snap in my back. Well, the pain is probably the most severe thing that I've ever felt in my life. I mean, the kidney dialysis is nothing compared to the back pain that I endured.
But besides the pain, the physical ache and discomfort, Each one of these people experienced another hurt, an agony that rooted deep inside, where they held their silent fears.
I was in fear of losing my job, losing my house, losing my lifestyle.
Or is it going to get worse and I'm going to have to, be in a wheelchair, walk with a cane?
That I was going to have back pain the rest of my life.
It's the little things, the joys of day-to-day life, the pleasures of simplicity that were blocked by the pain. Ordinary things for ordinary people that were now out of reach.
It's hard to remember, sleeping in a bed for a whole night.
I couldn't even touch the floor. I couldn't touch my knees. It was that bad.
Maybe you've been there, at a crossroads with your pain, not knowing where to turn, not knowing that the answer was well within reach.
I ran into someone who said you really should go to the Cleveland Clinic, that they knew a lot of people that were really impressed with the Cleveland Clinic, and he had also said they had a lot of the latest technology in their equipment, and he recommended that I see him.
When my doctor said I should have a back surgeon or a specialist, the first place I headed was for the clinic. I wouldn't have gone anyplace else.
So when she mentioned Cleveland Clinic, it kind of grabbed my attention. They can help kings and queens and all types of royalty and big entertainers. Certainly they could probably help little old me.
They're talking about the Cleveland Clinic Spine Center, a unique facility to Northeast Ohio offering patients specialized solutions and renewed hope that there is indeed a road to recovery. Since its opening, the Cleveland Clinic Spine Center, headed by Dr. Daniel Mazanek, has treated thousands of people with back and neck problems, easing not only their pain, but also their fears.
Many people haven't really been given all the options. They may have only heard surgery, or they may have heard live with it, but there are many options: medical, surgical, injections, a whole host of options, up to and including acupuncture, manipulation, aggressive physical therapy, that for most people will reduce pain and, just as importantly, improve their ability to function.
Well, in fact, if you look at the overall universe of back-related problems, surgery probably comprises only maybe 10%. So the vast majority of people with back-related problems do not need surgery and never will have surgery.
And most back pain will respond to an aggressive, exercise-oriented program.
After an exhaustive search for solutions with still no long-term relief from her pain, Anna Maria Cora was referred to the Cleveland Clinic Spine Center by Workers' Compensation and enrolled in the clinic's intensive 4-week work evaluation and rehabilitation program. Here she was not only challenged to adjust her physical and occupational mobility, but her outlook as well.
So I went to several places, and I was unable to get the long-term strength back in my back that I needed to have in order to go on with my life. It was terrible. It was terrible. It really was terrible.
The fact that she was now 7 or 8 months down the road and was not getting better and had been through a number of previous treatment programs, she really needed intensive therapy to have a chance to make a full recovery.
Dr. Mesnick told me, Anna Maria, I'm going to tell you. He said, I know you're in a lot of pain, and I know you've been hurting for a long time. He said, but it's not going to be easy. You're going to be walking, you're going to be stretching, you're going to be swimming. But I'm looking at him as if to say, this man is crazy. I can't even touch the floor. How am I going to do all of this? Believe me, I started doing it.
And it involves several different team members that the patient works with. One is certainly a physical therapist who focuses on 2 aspects of rehabilitation. One is rehabilitating the back muscles themselves, but the other is the general overall effort to improve the aerobic conditioning, the fitness level.
Not only did my back feel better, but let me tell you something, people, I toned up too. Trust me, I toned up.
And just improving aerobic fitness tends to improve back pain.
Anna Maria was working in a nursing home at the time, and so we tried to individualize her program toward nursing skills, toward assistant techniques, things such as transferring patients, pushing them in wheelchairs, lifting objects, building up just overall endurance to be able to tolerate a full 8-hour workday. Our occupational therapist worked more on fine motor coordination, on ergonomics, which is essentially changing your environment to meet your body's needs, so raising desk heights or chair seats and things of that nature.
They went from nutrition, body mechanics, stretching, career. So they hit every aspect of my life. They see where you're at. Like me, I came in on the bottom, okay? But when I walked out of there, oh girl was on top. I was on top.
Like 90% of patients with chronic back pain, Anna Maria was back on track and back in business without ever seeing the inside of the operating room. But what about the other 10%? We'll find out about how those back pain sufferers can be helped when we return to Back on Track.
How do you know when to call the doctor with a back problem? When your back pain has persisted for more than 10 days and is getting worse. When your back or neck pain radiates down your legs or arms. When you have weakness in your legs and have difficulty walking. Or when you lose bowel or bladder control.
For more information about the Cleveland Clinic Spine Center, call 216-444-BACK or 1-800-545-7718. Welcome once again to Back on Track. For those back pain sufferers that have not found relief through therapy and other conservative medicines, where do they turn for hope and answers? To find out how the road to recovery is paved for this remaining 10% of back pain sufferers, I've been joined by Dr. Ian Kalfas. Doctor,
How are you?
How are you?
Good.
It's good to see you. What is a neurosurgeon, and how is he different from an orthopedic surgeon?
A neurosurgeon is a surgeon that specializes in treating disorders of the brain, the spinal cord, and the nerves. An orthopedic surgeon takes care of problems involving the bony skeleton of the body. The spinal column is a structure of bone that contains the spinal cord and the nerves. So there's a crossover of anatomy there with both an orthopedic spine surgeon and a neurosurgical spine surgeon can operate.
You know each other's fields that well?
We do here. Certainly we work as a team together. I know what my strengths and weaknesses are, and the orthopedic surgeons do the same. And we utilize each other's resources when we feel it's appropriate for managing complex disorders of the spine.
So there's a sharing of responsibility?
Yes.
An easy crossover?
Yes.
I guess the big question out there is, how do I know if I'm the one who needs the surgery?
Well, generally patients who may be candidates for surgery include those individuals who have severe problems as far as back pain or neck pain, or pain radiating into your arms or legs, or weakness in the arms or legs. These individuals that have these symptoms that are not responding to conservative treatment may be a candidate for spinal surgery.
What is conservative treatment?
Conservative treatment includes such things as medication, physical therapy, cortisone injections. All of these things can help a large number of patients with spinal disorders. But for those select few who do not respond to conservative treatment, spinal surgery then becomes an option.
Mm-hmm. So there's an entire team of physicians at the Cleveland Clinic Spine Center.
There is a team of neurosurgical spine surgeons, orthopedic spine surgeons, as well as non-surgical spine specialists who all work together as a team to take care of a variety of spinal disorders.
Are some surgeries more common than others?
Yes, the most common surgeries that we perform on the spine include those operations such as laminectomy that are done for arthritic conditions of the spinal column, as well as a condition called a herniated disc, for which we do a discectomy procedure.
No. That's the same surgery performed on Joe Babica.
Well, when I first saw Mr. Babika, he was a 42-year-old gentleman who presented with leg pain predominantly.
I was really concerned. I was sweating, I was nervous, I was shaking. He goes, "There's nothing to this. I've done this hundreds of times." He goes, "You're going to go in, we're going to fix you up, you're going to feel great, you're going to have a new start on life."
He had what we call a disc herniation, and I can show you on a model here. The vertebrae are the building blocks of the spine. These are the bones. And the discs are the shock absorbers that sit between the vertebrae. The nerves exit the spine at each level between two adjacent vertebrae. Now, the disc shown here is a structure that's composed of two portions. The first portion, or outer portion, is called the annulus, and the annulus is like the layers on your radial tire. It has fibers going in different directions to give it strength. The central portion of the disc is a gelatinous substance. We tend to refer to it as a jelly, but in fact it's more the consistency of a crab meat. Now, if the outer layer of the disc should become weakened for one reason or another, then the central portion can push out or rupture through the outer layer. It can pinch on the nerves right here. And since these nerves go down the leg, patients will usually present with leg pain as a prominent feature of their complaint.
The pain in my leg got so great, it felt like someone was holding a hot poker to the back of my leg, that I should have had it done sooner, but I finally said, I've got to have the surgery. I've got to get out of this pain.
We obtained an MRI scan, which in fact showed that he had a herniation, and at that point, since he had exhausted all other measures that were reasonable to consider and was no better, he opted for surgery.
When I was going into surgery, I was scared to death, and I really didn't know what to expect.
What the operation involves is essentially entering into the spine at one of the openings that normally exists and perhaps removing a little additional bone so that the nerves, shown here in yellow, can be seen clearly, and the disc, which is pinching it, can also be removed. And that's called a discectomy. Typically, people who have disc herniation will have rather immediate relief of their leg pain.
It's the first time I woke up without total pain in my leg, and I was home within 24 hours and already recuperating.
For Mr. Babika, we would allow him to pretty much return to whatever recreational and other activities he would like, and I think his outlook is very good.
The idea of getting back on track faster is certainly a plus to many back pain sufferers. With the advent of minimally invasive surgery, some patients may get back on track even sooner. To explain it a wee bit better is orthopedic surgeon Isidore Lieberman. Dr. Lieberman.
Thank you, Ed.
What is minimally invasive surgery?
Ed, the recovery from surgery is directly proportional to the length of the operation, the length of the incision, and the amount of dissection that we have to do to get to the spine. So if we can get to the spine without damaging the surrounding tissues, the recovery is going to be much shorter. Let me show you on our training model. We have this camera and scope, which we insert through the abdominal wall, looking down at the spine, and then with these specialized instruments, we can do the exact same operation on the spine as we would be doing in an open fashion.
And just so I understand this, the whole procedure takes place in an area about the size of a quarter?
Yeah, that's correct. Because of the magnification and the illumination that we have in the scope and the camera that's inserted into the abdomen, we're able to focus the dissection on a very small area directly over the spine and not damage the surrounding normal tissues.
How do patients feel about minimally invasive surgery?
If you had your choice between a large incision on your tummy or on your back, 7 days in the hospital, 6 months towards your rehab, or 4 small incisions, 2 to 3 days in hospital, and into your rehab program within 6 weeks, what would you choose?
Yeah, I've got the picture.
I found that most of my patients are very excited about the small incisions. The biggest advantage for the patients, though, is their time to recovery, to getting back to their activities of daily living. We can typically get our patients back to that within that 6-week period. The one most important thing that I always have to emphasize, though, is that these minimally invasive techniques are not the right thing for every spinal problem. We have to be very specific in what we're treating and do the right operation with the right equipment.
What percentage of spinal procedures can be done endoscopically?
With the technology we have today, I'd estimate that we can do 10 to 20% of the spinal surgeries that we do in an endoscopic fashion. As the technology progresses and as we gain more experience, we're going to be able to do more and more for things like disc herniations, degenerative spines, and scoliosis. But I also know that with the biology and physiology research that people are working on, there's going to be less for us to do on the spine as surgeons.
All this was good news for Jan Zidek and her family.
As far as the pain, has become a lot worse than it was in '92. For the past, I would say, year, I've been sleeping in a recliner chair in the family room. I don't want to look at 20 years down the road and not be able to help myself. So I made the appointment and talked to Dr. Lieberman. He explained to me the procedure and what my options were, and I felt that what he was offering me was an answer. What they're going to do in my surgery is this new procedure with the titanium, the back implant. They insert those into your disc. They take out the padding that's in there that's deteriorated and put these implants in there, and they actually screw them in. And they've got holes in them, so then they pack those or insert bone in there, and the bone grows out of those holes, and then that's how it all fuses together.
Everything went very, very well. The surgery went exactly as planned and hoped. If she's comfortable, she can go home as early as tomorrow afternoon. Okay? All right. I think this is really going to be the ticket for her.
Several hundred physicians at the Cleveland Clinic manage just about every medical problem there is. Yet the care is one-on-one, even for patients with special needs, like Bill Kezor.
And I felt something snap in my back. And so I didn't think too much of it at the time, but the next morning I couldn't get out of bed. So I made arrangements to go to the Cleveland Clinic, which I've been doctoring there for about 30 years, and made arrangements to go there and to see a Dr. Robert McLean.
Patients with medical problems such as kidney problems, osteoporosis, a number of different types of general medical conditions can develop more significant disease or develop disease faster than their healthier counterparts. In Mr. Kezor's case, he never really got back to where he was before his kidney dialysis, and so we eventually ended up having to do some surgery for him.
The disc had ruptured and the vertebrae went down against the next vertebrae, which pinched the nerve that ran down to my leg through there. So that was creating all my problems.
We had his renal dialysis doctors, his cardiologist, all the other internists that we needed right here at the clinic, expert in the area of managing not only his problem, but managing those problems while he went through a process as stressful as surgery. We had them right there to work as a team. So we could do his operation and do it well, but we could also do it very safely, and that was the biggest issue for him.
Not long after I got out from under anesthetic, I thought maybe I must have died and went to heaven because I didn't have the pain, the severe pain that was shooting down my leg all the time.
And his recovery was so successful, and to see him so bright and happy after it was all over, I just knew that we were on the right road. And I was so afraid he could never lift or do boating. His boating is his life. He loves that.
I'm ready to start fishing.
It's wonderful to see Bill back on track again. But I've heard of people who've had spine surgery and still have pain. What's the good news for them?
At the Cleveland Clinic, we've established a pioneering program in the country looking at the further evaluation and treatment of patients who have had previous spine surgery that has failed. This is a unique program because it's an interdisciplinary program involving not just surgeons, but also medical spine specialists, chronic pain management specialists, interventional pain management specialists, physical therapy, and vocational rehabilitation specialists.
To help you maintain a healthy back, try to stay fit and active. Also, exercise regularly. Stop smoking. Maintain a healthy weight. And remember to lift with your legs, not your back.
For more information about the Cleveland Clinic Spine Center, call 216-444-BACK or 1-800-545-7718. The pioneering direction of the Cleveland Clinic allows doctors to push the frontiers of medicine, using today's labs to find tomorrow's innovative solutions.
What we're looking at down the road includes things like artificial discs and ways to actually replace the tissues that are there so that we don't have to do fusions, so that we don't have to remove perhaps some of the tissues as they degenerate. And as I mentioned before, perhaps developing cellular components or proteins that can stop the degenerative process, that can actually prevent the spinal diseases that we run into.
And I think as time goes on, we will develop new spinal implants that will be part biological or part living and part mechanical in nature, so that we can do a reconstruction operation. We can correct a deformity, we can fix a fracture, or replace a vertebrae that has a tumor with a new device that will become living tissue and, again, part of the normal anatomy of the patient's spine.
For the surgical patients you've seen today, the operation was only half the treatment plan. Long-term success comes with a commitment to keep fit and take good care of their spine through exercise and diet, all aimed to get them back on track with the lives they enjoy.
I'm better now. I've been to the clinic, and I'm this same independent person again, okay? I have an art studio. I couldn't do this a year ago. The Cleveland Clinic put me back on track.
It was the best decision he could have made.
It's changed my life. I feel a lot better. I'm more energetic.
Well, I would say it's definitely got him back on track with his business, family, and his personal life.
I am 100% sure that I made the right decision in having the surgery. There was not a doubt in my mind, and I said if I had to go through it again tomorrow, I would do it again. In a heartbeat, I would do it again.
So why suffer another day, even another minute with your pain? There is hope. There is a solution. There is the Cleveland Clinic Spine Center. This is Edward Asner. Thank you for joining me for this special program, Back on Track. For more information about the Cleveland Clinic Spine Center, call 216-444-BACK or 1-800-545-7718.